A very good afternoon to you all. On behalf of the Postgraduate Institute of Medical Education and Research, I welcome you to this webinar 9, and today we are here to discuss about oral healthcare services and COVID-19. And today we are joined with an esteemed panel of experts comprising Professor Krishan Gaba, who is the head of the Oral Health Sciences Center at PGI Chandigarh, and Professor Vidya Ratan, who is a professor of oral and maxillofacial surgery at Oral Health Sciences Center, PGI Chandigarh. So without taking any time further, I am connecting you straight away to Professor Gaba, and he would be talking about providing oral health care during COVID-19. Professor Gaba, please.
Well, good afternoon, everyone. So, straightway we will come to the today's topic, and it is on the dental considerations during the COVID period of this pandemic which we are facing. I am going to discuss under introduction transmission routes of coronavirus, algorithm for patient management, provision of dental treatment according to the level of restriction, possible dental treatment during COVID-19, precautions to be taken during the dental treatment, and considerations for private dental professionals, and then telemedicine as a choice and recommendations. Well, as you all know, the recent spread of COVID-19 has gripped the entire international community and caused widespread public health concerns. It's a challenging period for all of us on this earth, and more so for the medical professionals, because we are not only to take care of health of the masses as well as our own selves, but also we have to ensure that we do not spread the disease. Well, dental professionals, they are at high risk for nosocomial infection and can become potential carriers of the disease. These risks can be attributed to the unique nature of dental interventions, which include aerosol generation. As you all know, that lot of dental procedures, they involve using the different kind of equipment which generate lot of aerosols, handling of sharps, and proximity of the dental health care provider to the patient's oropharyngeal region, as we work very close to the patient. In addition, if adequate precautions are not taken, the dental office can potentially expose patients to cross-contamination. Several dental care facilities in the affected countries, including our own India, have been completely closed or have been providing only minimal treatment for emergency cases. Proactive and preventive measures need to be established as mainstay protocol to contain the spread of the virus. That is what is the current situation, and we have to tackle that. And of course, in due course of time, with the development of technology, we will certainly, I'm sure, we will land up and develop the things which we will be able to take care of the dental care or oral health care of the masses as well. Well, as you all know, that the transmission routes of coronavirus through direct transmission, contact transmission, and contaminated surfaces, these all things are prevalent in a dental practice setup, and of course we come through that we and that is where we have to be very particular and careful. And if we look at, if an infected patient come through airborne droplets, through aerosols, through contaminated surfaces, and 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 also through susceptible individuals, ultimately it leads to involvement of the dental professionals, and then through dental professionals further through the again droplets and aerosols, it can go to our own healthcare providers, that is our own colleagues in the clinic as well as outside, and then also to the masses. And that is where we have to be very particular and very careful while performing the taking care of the oral health care of the masses. Well, patients which need to be avoided during dental treatment during this period of COVID-19, all symptomatic individuals who have undertaken international travel in the last 28 days. Now, at this moment, maybe in our country at the moment, since international travel is almost stopped, people may not be there, but certainly people with history, and then they having come in contact with others, and you never know who are in asymptomatic state and they are transmitting. So this history is very important and we should be careful. All hospitalized cases in the last 28 days, all individuals who have come from hotspot areas must be tested first. All healthcare workers in a hospital setup who are symptomatic, and of course, patients who are with active fever, cough, cold, malaise, diarrhea, or loss of even the taste sensation, such like things we have to keep in mind, and we should be get alert and can avoid doing dental treatment in such before they are tested for that. Then history of direct contact with the COVID positive cases. Why we need to stop this elective procedure in dentistry is because cannot reliably identify who are asymptomatically they infected and are carriers. More chances of infection from patients as many dental procedures they generate aerosols, and most important is the judicious use of PPEs. We have to be very careful where to use PPE. If we start, taking using PPE in small, doing even examination, oral examination and all, and taking care of the dental, what about the other emergency and urgent cases? We are short of the world over, we are short of supply of PPG, so we have to be very careful. And people should not leave their houses without essential needs. So all the keeping all these things in mind, this is what we should be very selective while doing, and very careful while taking care of the oral health of the people who report to us in a dental setup. Now, what is the algorithm for patient management which we are following at the Oral Health Sciences Center at PGI? I am just going to touch upon those things. This is keeping in view the international recommendations, WHO and other international bodies' recommendations, and our own experience over this short period of 2-3 months. Any dental patient, the most important is to do the initial screening for assessment of the severity, which can be done through telescreening or through initial patient evaluation. And now, if there is some patients who are with some need urgent care like apical periodontitis or apical periapical abscess, pericoronitis, or some post-extraction complication or trauma, tooth fracture. So all such cases, or with some extraoral swelling which is there uncontrolled, and it's leading to Ludwig's angina, or there is tooth avulsion. All such cases are such that they cannot wait and we need to attend to them, and how that I am going to come in the subsequent slides and subsequent discussion. And however, the elective care which can be, where the condition remains stable for a period of time, like such as some even fracture restoration or minor dental trauma or any kind of things, those which can elective procedures which can wait, we should not at the moment be over enthusiastic to take care of them. First, our care should be managing the urgent care and emergency care. And for such care also, wherever pharmacological management can be done, and of course the telephonic follow-up of such patient is very important. They should not be just left after pharmacological management. And however, if such emergency care or urgent need is there, immediate treatment is needed, then we should be careful to go in for even some testing with a short period which is there. That is the test which gets available in gene export system, which is in 2 hours time we can get the report, or wherever we can wait, or elective procedure is to be done and is done to be done must, and it can wait there. We can do the routine, that is the PCR RT COVID evaluation. However, other elective procedures we should try to defer for a few weeks. And most important is the risk assessment through the questionnaire. That is very important, looking at the signs and symptoms and the travel history, the epidemiological risk, the area from which they are coming, and if there is a suspected case, then such cases, then we should refer the patient to the COVID medical facility for emergency management and treatment and for its testing. However, where there is no such kind of signs or symptoms are there and there's no travel history, there we can perform the dental treatment without producing the, but again taking care that while performing the dental procedure, that we should not resort to such kind of techniques where aerosol production is there, and taking care of such measures which we will discuss in the subsequent slides. And another thing is, while before taking up any patient, the most important is to know the pre-screening form, and for that, the complete details of the patient, its his contact number, his address. That's very important, because so that subsequently, when any kind of development which takes place, we are able to follow and we can go back to the patient and understand, and taking a complete history as far as the in the past 30 days, if you have come across any member has traveled abroad or has come back from abroad, or any relation of ours has come, or any household member has come in contact with a known COVID patient, or there has been a history of exposure to the biological material associated with COVID patient, then have you had any history of fever or cough, difficulty in breathing, diarrhea, nausea, body aches, all such things must be noted down clearly and recorded. And this maintenance of record of each patient, that is very, very important for a number of reasons. Not only for providing the treatment, even for following up also further. And then based on this, the chief complaint and what treatment is required, we should clearly see and record also whether it needs some invasive procedure where we need to have PPE or not. So all these things need to be recorded in the complete history and the record. Then thereafter comes the provision of dental services according to the level of restriction based upon the proportionate and the pre-planned response, and we have received from this. Then we can stage the restriction of the dental services to reduce the transmission of the risk of COVID and avoidance of likely burden on the medical primary care and emergency services. Now I will cover up, depending upon the various kind of restrictions we have. Level 1 restrictions are that all dental treatments using the standard precautions for people who do not meet any kind of clinical signs, symptoms, epidemiological features, taking all precautions of infection control, such treatments can be taken up. But defer the non-urgent treatment for people who do meet certain epidemiological or clinical symptoms criteria of the COVID-19 patient. And there only the urgent dental treatment has to be taken care of. And level 2 restriction is that the provision of the dental treatments that are likely to, we should avoid, doing any kind of procedure which can generate aerosols or the presence of minimal saliva, blood due to so, and preferably do the treatment under rubber dam wherever it is possible. Whereas wherever there is need for any high-speed handpiece or rubber dam cannot be applied, ultrasonic scalers are required to be done or used, or surgical handpieces. So avoid all such kind of treatment where this thing, and defer that rather than avoiding. It's deferring, and in due course of time the developments will take place, and certainly we with all advanced technology we will be able to take up such cases also, because as it appears that this pandemic is spreading and is going still the same way, and so we cannot all the time close down the clinics. We have to work on the patients and we have to take care of the health of the masses. So all surgical extraction, those they should be referred to the oral surgeon, and which after proper following the procedure for using the transmission based precautions, they can be undertaken, taking use of the PPEs and in a proper way, as I will come subsequently. Then is that all elective implant dental treatment that can wait and should be delayed and should be deferred. Only dental treatment that do not generate aerosols. Again, I am emphasizing that management of the patients with acute dental pain or any abscess is there or any extraction of a loose tooth or a tooth which is causing pain or swelling, that can be undertaken after having taken care to manage with any painkiller or antibiotics. If still is we are not able to manage, we can take up, but with taking due precautions. However, the extractions of asymptomatic teeth without any swelling, broken or even chipped tooth or teeth, so such things can be deferred and uh, can of course subsequently be taken up. Another level of restriction is, of course, management of the complex medically compromised patients which have got certain dental concerns. Those may not be compromised and should be taken care of for any systemic disease, and such then urgent dental care should be taken care of. But even for such patients, if there is need of any denture concern, crown and bridge work, scaling is required to be done, ultrasonics is required to be done. So those should be deferred, and only urgent dental treatment for such people should be taken up. And then only the following dental treatments which can be managed, that is swelling of the orofacial region, any dental trauma which is causing change in the tooth position, avulsion, so which cannot wait, should be taken care of. Difficulty in opening jaw, referral from medical specialists, or dental pain which is causing loss of sleep. So these things should be attended to. How these should be attended to, that I will come in. No routine dental treatment should be provided, that is taking care of routine restorations or routine root canals, so those can be deferred. And of course we should look at the whatever the local and our national guidelines are there, that should also be taken care of and should be taken accordingly. Well, the possible dental treatment which can be done during this period, the aim of the treatment should be to minimize the creation of aerosol by eliminating the use of aerosol producing devices like the air turbine drills, ultrasonic instruments in practice, reduce the chairside time and minimize the doctor to patient contact. So try to perform in one sitting only as much as we can, and rest of the things we can do follow up through teleconsultation or to otherwise on telephonic way of personally contacting, but try to avoid the number of visits. Perform procedures that will work well in the medium term and allow for the future improvements or upgradations. Have a balanced approach towards satisfying patients' dental needs and looking after the well-being of the patient. And this we must be careful, of course, about our fellow doctors as well as our supporting staff also. Then these are some of the procedures I have tried to list, like say for example management of carious lesions is there, which is not involving pulp. Try to use the hand instruments, try to excrete as much as, and give glass enamel filling wherever it has to be done, because patient is very uncomfortable because of the food lodgement or other things. And wherever there is some swelling or some abscess there, you need to open up the root canal, taking care of all precautions, and you can do that. And prosthetic work, dental dentures and all, and crown and bridge work, those can be avoided, that can be deferred. And in aesthetic dentistry, again, such things we can defer. However, where minimum possible is required, that is fine, can be taken up. But subsequently also, when we develop or when we refine our ways of handling such patients, again the chemical disinfection of the impressions of the dentures or while doing the various stages, the bite blocks, so that will be required and has to be taken care of. In the periodontics, that try to avoid scaling, but if at all you have to do, if there is some bleeding or something of that is there, then instruct of good oral hygiene, interdental brushing, and proper care. And if at all scaling is required to be done, only hand instrument should be used. In the radiology, try to take the extraoral X-rays or panoramic X-rays, then we can avoid the implant dentistry, which we can defer. In the orthodontics, again, debonding should be deferred. It's not something. However, even while changing the wires or ligature, extreme care is needed because it can lead to some lacerations. And so try to be, and then three-way syringe we cannot use. So try to do, if at all somewhere you have to use the that chips blow, that kind of old things which we used to use for putting the air. Then precautions to be taken during the dental treatment, prefer working from 11 o'clock or 12 o'clock position, so that the as much far away you are as much possible from the patient. PPE is for aerosol generating or surgical work. This is most important, and we must, proper use of PPE, donning, proper way of donning and proper way of doffing, that must be done, which the next speaker will take up in more detail. Then clinical micromotor or the quadrangle handpiece that can be preferred, or electric driven motor, and the speed increasing handpiece that can be used, but air rotor should be avoided. And then is another thing which we are working, and the world over people are also working, that is making certain canopies, that is aerosol restricting canopy, which can be put on patient. I will show in the subsequent slide. Avoid using three-way syringe, avoid use of intraoral radiographs, or should be performed very cautiously and carefully. Well, this is the kind of the aerosol restricting canopy which can be put on the head side of the patient, and with the perforation as there, from which with after putting the PPE kits and gloves, you can put your hands through this, and assistant can put his hand from the other side with the suction, and we can do this kind. But again, for such like of things, avoid using the centralized suction, or even avoid patient to spit into the sputum, because that will get into the whole unit, so that should be avoided. So portable suction that should be used, or extraoral suctions which are also coming up nowadays, those should be used. But still, this that is the aerosol restricting canopies will be of quite useful, and have been found to be useful. This is what we have developed with the help of CSIO, as well as through our own engineering department, and we are in the process of getting such, and then subsequent treatment more and more treatment can be taken up by using this, because this way the aerosols getting into the air will get restricted. Well, this is a chart which will tell you that what is the scope of work, and where you need to put what all, layer kind of thing, where head caps, surgical masks, N95 masks, eye protection, and PPE kit, gloves, disposable plastic gowns. So patient registration, minimum 6 feet distance should be maintained. Even the one who is at the registration counter making the registration, head cap and surgical mask is a must. And whereas for even history taking, record registration, or any kind of simple examination, the head cap, N95 mask is must, eye protection is must, gloves is must, and plastic gown is must. But however, wherever there is some aerosol generating procedure is required, so their canopies, such kind of canopies should be used. And then of course complete PPE kit with disposable body suits, that is what is required. And for disinfection and disposal of biomedical waste, head caps and 995 masks, eye protection, gloves, those are must. Well, further precautions to be taken during the dental treatment, extractions, surgical procedures to be done, as much, not just putting your cell phone to the patient, but keeping the distance. Magnification will be advantageous because vision will be better. Use autoclaved instruments, no compromise on that. Avoid escorting the patients to the going out of the clinic or to the waiting area. Maintain social distancing. Preferable to give non-overlapping appointments so that you can after doing the patient also you can sterilize your area well, and you can totally sanitize the area then and relax and then go in for the next appointment, because all these things are stress generating, so you have to be prepared for it. Well, who should avoid practice in dental offices? That is very, very important, and in the present scenario, that is dentists and paramedical staff who are above the age of 65 and with underlying such conditions like diabetes, chronic liver disease, heart kidney disease, chronic lung conditions like asthma, COPD, or cancer, or pregnant, women in such setups, seropositive status cases, those should avoid practicing the dentistry at the moment and defer for some time. Any dentist or the allied staff with a travel history or coming in contact with such people, or with a coming in contact with a positive patient, anyone suffering from cough, cold, fever, or such symptoms, that is what we should take care. Then guidelines for the consulting room and the waiting area: scan the body temperature when the patient comes, strict appointment scheduling, no crowding in the waiting area, patient should be encouraged to come alone, anything which cannot be disinfected easily should be removed, masks, foot covers, hand sanitizer should be at least available for the patient. The front office's managers, secretary should be in mask and gloves, sanitize, and when you take the consent, discard the pen after using. Use simple low costing pens for while recording or while taking the consent. Take history orally and record it, and then store it to be later entered into your respective files. Respiratory coughing etiquettes with disposable tissues, waste disposal unit in the waiting room also. So that is what we should take care. Well, this is very important. The In view of the present scenario, the consent form, and Indian Dental Association has worked very hard on it, and they have prepared this. And I would like to go through this consent, very carefully with you. Apart from noting this thing, that patient writes that I so and so knowingly and willingly consent to have dental treatment completed during the COVID-19 pandemic. So let patient understand this very well and should sign to this. I understand the COVID-19 virus has a long incubation period during which carriers of the virus may not show symptoms and still be highly contagious. It is impossible to determine who has it and who does not give the consent current limit given in the current limits in virus testing. If I am at the moment any asymptomatic carrier or undiagnosed patient with COVID, I suspect it may endanger doctors and clinical staff. It is my responsibility to take appropriate precautions and to follow the protocols prescribed by them. I am aware that I may get an infection from this clinic, also may be possible, or from a doctor, and I will take every precaution to prevent this from happening, but I will not at all hold doctors and the clinic staff accountable if such infection occurs. So this is very important and must be read to the patient. It's not that patient is just made to sign this consent form. Each component, each word must be read to the patient and explained. And then, most important is I understand the government recommendations social distancing of at least 6 feet and for 14 days to anyone who has shown symptoms. So I will take care and inform if any development takes place in due course of time. I will inform the doctor and the clinic concerned. Well, directive to patients: inform your patient that you are back to work. However, pain management would be given priority, and also certain rules need to be followed, and rest of the treatment may have to be deferred. Elective procedure, especially oral prophylaxis, not recommended. Clinical practice by appointment. Don't allow random walk-ins. Patient plus one attendant at best if it is child patient or if it is some old patient, preferably digital payments, face masks to be worn by patient as well as the attending dentist at all times except when ready for the oral examination. Dentists have the legal right to reject patients with unreasonable demands. So that is what we should know and we should be aware of that. Well, psychological management of dental clinical staff focus on longer term occupational capacity rather than, so try to finish as much work as possible in the appointment which has been given, ensure good quality communication, convey everything to the patient as well as to the staff members very clearly. Do not mind repeating, you can explain again and again. Update staff with accurate information, rotate workers and partner inexperienced workers with more experienced colleagues. So buddy system should be followed. Those who are good, the others can observe and can follow in due course of time. Encourage staff to use helpful coping strategies such as sufficient rest, respite during work or between shifts, eating. Tell them to eat sufficiently and choose healthy foods, avoid use of tobacco, alcohol or such like drugs. Refresher training, we should not mind undergoing again and again in infection prevention and control ourselves as well as our staff. Well, another thing is that telemedicine is a choice. Use of teledentistry can play a vital role in screening as well as in initial triage of the patients, and then subsequent can be taken up. Beneficial to those at high risk of being affected, elderly, especially children. Dental pathosis and oral lesions are directly observable, hence photography may be a valuable diagnostic tool, and patient can send you that and you can go through that and recommend accordingly. Smartphones with internet connections can help patients to interact with dentists. Confidentiality of the patient data must be, of course, be established. And these are while doing the teleconsultation, these are the points, and of course, teleconsult and its legal aspect that should be kept in mind. Talk to all patients on phone prior to calling them to the clinic. Make all attempts to screen these patients for symptoms or signs of COVID and refer appropriately if suspected. Depending upon the symptoms, ask for some basic investigations done before the patient is called to the clinic. Audio record the conversation with the patient and of course with the consent of the patient. Preferably use the over-the-counter drugs, not something we try to prescribe which is of rare thing. So if not audio recorded, then make an entry into your diary like you would be if patient was seen by you physically. So that record is very important and must be maintained for subsequent any kind of consequences. Recommendations are access reliable, authentic, share the authentic information and provide and try to well verse yourself with the up-to-date knowledge. Abide by the recommendations from the local, state and government rules and guidelines. Postpone the elective procedures, surgery and non-urgent dental visits. Proactively communicate to both the staff and the patient the need for them to stay at home if sick and should convey clearly. Use teleconferencing or teledentistry option to contact patients prior to emergency dental treatment, and know steps to take if a patient with COVID-19 symptom enters your facility. So you should be able to recognize. Well, at the Oral Health Sciences Center, we have the teledentistry setup, which is there, and these are the numbers. Anyone can approach this. We have created a special exclusive email also for people to send their all problems related to that through email also, and this is available and will be put on the PGI website also. And well, this is our otherwise also the dental emergency helpline, and which has been functioning, and this can be which is there for 24/7 emergency service which is there. And of course, these are the references and the online resources for the COVID-19. Well, thank you very much for being patient and listening.
Many thanks to Professor Gaba for such a deep insight into the issue of providing dental care during this COVID-19 crisis. And this is your time to post your questions to us through the live chat of YouTube which is going on. You can very well post us your questions, and we would be taking as many questions as possible during the question and answer session, which is scheduled at the last. And before proceeding with the next speaker of the day, Professor Vidyarathan, we will be breaking for a very short break, and we are back in less than a minute. So welcome back, and straight away I am connecting you to Professor Vidyarathan, who would be talking about infection control practices and rational use of personal protective equipments in dental practice. All the way to Professor Vidyarathan.
Good afternoon. As you know, that COVID-19 is quite contagious, and world over, thousands of healthcare workers have been infected with it, and many have succumbed to it. So, as a dentist, we are at quite a risk because we are working in a close contact with the oral cavity, and we love our hand pieces, power tools, and these days we have been restricted to use these instruments, and I cannot imagine dentistry without using these instruments. So we use high-speed drills, ultrasonic instrument, piezosurgery instrument, and without these we cannot cut or restore hard tissues. And when we are working, there is quite a big generation of splatter and aerosols. So chances of getting infection during when we provide treatment to the patients are quite high. So therefore, we have to prevent cross-contamination in a dental setting. From patient to healthcare workers, from healthcare worker to patient, and through fomites in the clinic from one patient to another patient. So objectives of my talk are how to practice infection control in dentistry in the time of COVID-19, and how should we get back to work. So breaking of the chain of infection is very important. In 1980s, when HIV came, then there were established procedure of universal precautions, in which there was concept that all blood and body fluids might be contaminated and should always be treated as infectious. And later on, in mid-90s, these were changed to standard precautions, in which we have addressed the concern of airborne transmission such as TB, influenza, varicella, and now new virus which we have encountered is COVID-19. So how can we get back to work? Dr. Kaba has clearly established what precautions we have to take. Basically, we have to ensure triage, we have to recognize early, and we have to recognize source control to prevent the spread of epidemic. And we have to apply standard precautions to all the patients. And these precautions must include prevention for airborne infections. We have to take care of our environment so that we are not spreading infection through by touching various touch and non-touch surfaces in the clinic. And we have to work safe working practices in our clinics, and we have to change some of the engineering and administrative control to check this pandemic. So there are various tests which are available whether patient is suffering from COVID-19 infection or not. These may be antigen based or these may be antibody based. At present in our country, we have restricted number of these testing kits, so we cannot use these kits for each and every patient at the moment. For example, this antigen based test, which is RT-PCR, it takes around 6 to 8 hours for reporting. Recently, WHO has approved a test which is molecular based automated version of PCR test, which is Gene Expert. We can expect results within 45 minutes. And antibody based tests like these are point of care tests, but at present these tests are not available in our country. In maybe in due course of time, with innovations and industry participation, new tests and innovation will be there, and we will be able to pick up these patients early. When these tests are available, then when there is a planned procedure, if point of care device test is available, then you must do this test before doing any treatment, and if it is negative, then you can proceed with the procedure with standard precautions. But there is a window period where these tests cannot pick up whether the patient has got this disease or not. Then we have to follow standard precautions of all patients. Standard precautions means we have to follow hand and respiratory hygiene. We have to use personal protective equipment according to the risk assessment, and then we have to use all the instruments which are sterilized. We have to take care of our surface and environmental cleaning. Then we have to follow safe practices at workplace like precautions during injections and invasive procedures. And then we have to follow safe waste management practices as we are generating waste during all these procedures. Coming to hand washing and hand hygiene. This is the most important aspect, and proper hand washing can reduce infection transmission by quite a bit. And this is the most neglected area in healthcare setups, and compliance as low as 30 to 40% have been reported in various studies. So we have to improve our hand washing, and before hand washing we have to remove all the hand jewelry and arm jewelry so that your gloves can properly fit onto your hands. And you have to wash hands properly. I am not going in detail of proper hand washing technique because I expect every dentist knows how to wash their hands properly. And then wearing of gloves during any procedure is very important, and you have to select proper size of the gloves, and you have to select whether you are using your examining gloves or your surgical sterile gloves depending on the procedure, or heavy duty gloves while cleaning. So proper selection of the gloves is also very important. Then coming to personal protective equipment. Personal protective equipment is basically a barrier which prevents spread of disease. It consists of gloves, masks, goggles and face shield. Then you have your various types of gowns, which may be coverall or plastic apron, and then you have to wear shoe covers and caps or hair cover. Basically, you are taking a barrier, a shield onto yourself so that nothing can be transmitted from the patient or from environment onto you. So these are the recommended protections by CDC and WHO for COVID-19 management, and you have to follow these strictly. Then there are various types of masks. This may range from 3-layered surgical mask to a face piece respirator, which is filtering particles at various capacities. So N95, N99, these are the US standards, and FFP1 or FFP2, these are the European standards. N95 and FFP2 are almost same standards, and these can filter 0.3 micrometer particles up to 95%. And for management of the COVID patients, at least N95 mask is recommended, and FFP1 or surgical mask which filters less than 80% of the zero point 0.3 micron particles. These are not recommended for managing patients with COVID-19. And these are N95 masks. Then these provide protection around 99% of the time. But there may be risk of transmission from the healthcare worker to the patient if these masks are not properly fit. And there are two kinds of N95 masks. These may be valved and non-valved. Valved masks have a exhalatory port and they are easy to expire. And in non-valve masks, there may be some difficulty in breathing. But when you are wearing a non-valve mask, it gives you good protection as compared to valve mask. Because when you are using a valve mask, there is no filter. When you are exhaling, it opens up to the environment, and this may give less protection against aerosolizing procedures. And then you are exhaling directly onto the patient. So there is more risk of transmission of disease from healthcare worker to the patient. So in a clinical setting, valve masks should be avoided. And if you have bought it, and then you must wear a surgical mask over it so that droplets which you are exhaling are stopped by your surgical extra layer mask which you have worn. And proper fit of the mask is very important, and these masks N95 must be put on correct way. These should be making a nice seal over to your face. There should be no air leakage, and these masks should not be hanging onto your neck. Once you have worn it, and then you should not touch it. And these masks are single use, and you should not reuse these masks. Then whenever these masks are damp or wet with your sweat, you should replace them. Do not touch the front of the mask, and when you are removing them, then you have to remove it from behind. And after removal, then you have to follow hand hygiene, because front surface of the mask is considered to be contaminated. And these N95 respirators are not designed for use in children and people with facial hair, because when you have a beard, then this will not fit easily. There will be loose fit, and then there may be risk of transmission of the disease. These are other types of respirators, half respirators or full mask, but these are also not suitable for dentistry because these again have a valve for expiration. So other is powered air purifying respirator. This is a motorized device which is throwing clean filtered air onto your face with the type of device which you are seeing on this picture, and there can be a disposable surgical hood which you can put over it, and this will give you full protection from outside environment. You are breathing your clean air, and there is no exhalation onto the patient as well. Coming to face shields should not be used as a solitary face eye protection, but rather as a adjunctive to other protective measures such as face masks and goggles. As you see in this picture, these lack good facial seal peripherally, and when you are using your aerosol generating procedures, there may be penetration from the sides or from below onto your face, and then this disease may be transmitted. But these masks, these face shields give you prevention from splatter, which is directly coming onto your face. Coming to gowns, there can be various types of gowns like coverall gown, gown with a hood in which there is a special head cover, and then surgical gowns and plastic aprons. Whenever you feel there will be a lot of blood and your gown can get soaked, so you should wear a plastic apron below it. So there are various levels of protection, and for COVID infection, level 4, which is the highest fluid and microbial protection gown, such types of gowns are recommended for wearing. Then, depending on risk assessment, whether you are just examining the patient or you are going to do a treatment onto the patient, then you have to select PPE depending on your risk. For just dental examination, these coverall gowns may not be required. Just you need eye cover, head cover, and a simple surgical gown, which may be of cotton and reusable also. For example, in patient triage area, where there is sufficient distance between the patient and you, then you can wear these simple surgical cotton gowns which can be reused after washing and autoclaving. There are certain problems with these coveralls because these are not available in various sizes. For example, one of the residents is wearing this large coverall which is not fitting properly, and she is feeling very uncomfortable. And then there are also problems of not sealing your face very well. For example, on your left side screen, you can see still some areas of the skin are exposed above the zip and near the forehead area. So this should not be there if you want proper protection. And on this right side of the screen, one of our resident is using powered air purifying device, which will give you complete protection, and these should be used while doing your aerosol generating procedures. Coming to donning and doffing, donning is putting on the PPE and doffing is once you have done your work and then taking off the PPE. There are video links there on PGI website which you can go through how to don and doff this area. Doffing is most important because most of the infections which have been reported occur during doffing because you are removing your contaminated. So hand washing and scrubbing with hand rub or alcohol based hand rub in between every step is very important. You can go to PGI website and there are certain videos there which you can see how to properly don and doff. Coming to sterilization of instruments, this you have to follow as we have been previously following all these steps of cleaning, washing, drying, packing, sterilization with depending on the need with steam autoclaves or plasma sterilizers. And then dental unit water lines can be taken care of as we have been
taking care of them previously. You have to use hand pieces with anti-retraction walls. When you start working your day in the morning, you have to run it for 1 or 2 minutes idly, and in between patients you have to discharge water for minimum to 20 to 30 seconds. And for disinfection of water lines, you have to follow manufacturer's instructions for disinfection. And then what we can do to reduce the dental aerosol generation. Personal protection barrier with powered air purifying respirator is important when you want to do specifically aerosol generating procedure, for example, crown cutting or root canal opening or high speed drill you want to use. Then pre-procedural mouth rinse will decrease the number of bacteria and viruses in your mouth. Then use of rubber dam will also reduce the number of organisms which will be flowing into the aerosol. Then you have to use high powered suction along with your high speed drill that reduces around 95% of the aerosol generated. It is sucked into the high powered suction, and then these days extraoral suction devices are available which can come over as a hood when you are working, and like a chimney this will suck the aerosol which has been generated. And then for taking care of the air quality, you need to add HEPA air room filters, and you should think of ultraviolet treatment of your ventilation systems and ultraviolet rays for disinfection of your clinical areas. This is an extraoral suction device which comes over as a hood, and this will suck the aerosol which has been generated during the procedure. And these devices are being propagated, but I feel these are restrictive and obstructive. You cannot do the skill and finesse of dentistry which we require during our procedures. Maybe you want to take a sample or just examine the patient, or you just little bit grinding you can do with these procedures or with these devices. But I feel if you start doing a procedure, then your neck and back will be suffering a lot. So what precautions we can take for preventing airborne infections? Ideally, we should have negative pressure isolation room at least 12 air changes per hour. Then we need to have well ventilated rooms. We can add air purifiers. And if you put simple exhaust fan on, that will also help you in creating negative pressure in your room, and that will improve the air quality. And coming to disinfection of surfaces, these viruses, particularly lipophilic viruses like this COVID-19, good news is that it is the easiest to kill amongst all. Being bacterial spores, hardest to kill, and these lipophilic viruses are easiest to kill. And these are amenable to low level and intermediate level disinfecting agents. So when you are working, there can be clinical contact areas and housekeeping surfaces. So you have to take care of these clinical contact surfaces and housekeeping surfaces with various hospital-based disinfectant, just like maybe simple detergent for floors, walls, and sinks. And for clinical contact surfaces, you may use intermediate level hospital-based disinfectants. These consists of like phenol, sodium hypochlorite, citric acid, quaternary ammonium compound. All these agents are able to kill this human coronavirus. And you have to use standard barrier techniques where you are going to touch these, and after doing your patient, you have to throw these barriers with proper disposal of the waste. And recently, we have started using this steam disinfector for disinfecting our chair units and surfaces. This produces a super dry heated steam at 140 to 180 degrees centigrade, and then It ensures effective disinfection and it does not leave wet surfaces. It quickly dries and steam can reach nicks and corners, all the areas which are difficult to reach with the help of your chemical disinfectant. And this is a video showing after or before starting your treatment. Just you can use this disinfector and it very quickly, within a minute, it will disinfect the chair, and then you can, after disinfecting, you can shift to surfaces, and it is chemical free. Otherwise, foggers use chemicals which may be harmful. Other agents which we can use to disinfect environment is ultraviolet light, particularly in the range of 250 to 280 nanometers, which are type C ultraviolet rays. A problem with these devices are there may be shadow areas in the clinic and air pockets where these ultraviolet rays cannot reach, and these rays are harmful to skin and eyes, and this cannot be used when room is occupied. So when these are put on, then you have to leave that room. And then these are the devices which can improve the quality of air, like HEPA filter based air purifiers, simple exhaust fan, or in the market for industrial uses, UV light based purifiers are also available, which you can install with the help of engineers onto your clinics. And then you have to look for proper PPE, and how can we get back to work or aerolized dentistry, what instruments we need. So you have to dedicate a separate room for aerosolite dentistry where these devices are there. Then you have to use six-handed dentistry, one operating dentist, one your assistant, and then one your circulating assistant. All these will be using full PPE with coverall and sterile gowns, and then you need to have 3 powered air purified respirators for foolproof protection. And then you have to use air purifiers, exhaust fan, well ventilated rooms, and you have to take care of the surfaces with the help of various hospital based intermediate disinfecting agent, which may be chemical or UV light based or steam based. So with this, I will come to end. So COVID-19 is the easiest virus to kill on environmental surfaces, and standard precautions of infection control need to be followed to take care of this infection. And with proper standard precautions and equipping ourselves with available technologies, dentistry can be practiced safely without cross infection. Thank you.
Well, with the proper standard precautions, dentistry can be practiced without cross-infection. And with this, I want to thank Professor Vidyaratan for such a deep insight into infection control practices in dentistry during COVID-19. And while this is your last chance to post us your questions, and we would be taking up almost all your questions in the panel discussions. And for the panel discussion, we will be back in less than a minute. So welcome back, and so we are here with our esteemed panel of experts, Professor Krishan Gaba and Professor Vidyaratan from Oral Health Sciences Center, PGIMER, Chandigarh. And we will try to take your questions one by one. So, Professor Gaba, thanks for the very nice presentation. An important issue which is arising over here is the use of rubber dams while doing most of the procedures. So, can you throw more light on the importance of rubber dam and why is it recommended more during this COVID crisis?
Well, rubber dam otherwise also in dentistry routinely should be used, especially while doing root canal or even for the restorative work, and more so in to spread because saliva in the oral cavity is there, and then while working we come in contact with saliva, and saliva otherwise also at times the submandibular duct that is so frequent that certainly a spur of the saliva comes on the on the operator's face. So hence, if we will put the rubber dam, we will be taking care of all these things, and the suction will be more effective because directly we can put it over there and it will be useful. And it's a simple procedure. Putting rubber dam doesn't take more than 3-4 minutes, and I think all dentists, they are taught about using rubber dam, and when they practice this can become very useful. And in the present scenario, I'm sure the more and more dentists, they will start using rubber dam, and it will be really, as because of COVID, people have stopped spitting on the floor, and I'm sure the dentists will start using the rubber dam more frequently.
Well, thank you, sir. Professor Vidyarathan, you had talked in detail about PPEs and masks, but there had been a common issue of quality of these PPEs and masks because initially we used to import most of these equipments from abroad, but now because it's a pandemic, it's a worldwide crisis, so these are being manufactured within our country, and there are many vendors, some local vendors who have come up manufacturing these equipments. So how important is to ensure the proper quality of the mask and as well as these PPEs, because there are so many of them which are available in the market?
So quality is very important, because if it is not giving you protection, then what's the fun of using it? So you have to follow certain standards. Manufacturers have put labels on this, and whether these are ISO standards or NAOH standards. So you should look at the label, and then you have to go to that website of that agency which is following those standards, and check whether that manufacturer is registered or not. And you should read the label of the mask and PPE equipment very carefully. It is written there whether it is what GSM and what grade, whether it is level 1, 2, 3, or 4 grade. Then you have to choose best equipment for you, because if your equipment, protective equipment, is not efficient, then you might suffer infection.
Well, so the take home message is that we have to read onto the labels very carefully, and after reading onto the labels, we have to go back to the website, the certification website, and we have to verify whether it is a genuine equipment or not. Taking ahead this talk about PPEs and masks, you had touched an important point about doffing. Donning is just like wearing of these personal protective equipments, but doffing is very important, and there are some concerns where, despite using the best available equipments, many healthcare workers have been tested positive with COVID-19. So, what can a dentist do to ensure that doffing is properly done? Some space requirement is there, or supervision, or what all do you want to say about it?
So doffing is the most important aspect, because you are carrying infection onto, and inside of the PPE kit is considered which is not infected, and outside area is considered as infected, and in between steps you have to use your hand rubbing agent to clean your hands after every step. And particularly area you have to designate in your clinic with a demarcated line between clean and unclean area. Then you are sitting in an unclean area, and stepwise you are removing your PPE kit. And once at the last step if your last step is removing your shoes and mask, then you remove one shoe and then step onto the clean area. And then you remove second shoe in the dirty area and then you move into the clean area. And last and at the end you are wearing your mask. And mask then you have to untie from the holding strings at the back, not touching at the front surface. You remove it and throw it into the designated bin, and then you have to hand rub and thoroughly hand wash, and then you have to change your clothes, come on to your normal home wearing clothes, and then you have to go home.
Well, thank you, Dr. Vidyarathan. So the take-home message is again quite clear over here that doffing is very, very important, and there are certain steps in doffing which are to be followed. There has to be a clearly demarcated doffing area where the clean area and the dirty area is quite clear. A clean demarcation should be there, and preferably it has to be supervised to ensure that your team and you yourself remains safe. Taking the talk ahead, Professor Gaba, can you throw some light on the PGI protocol of managing the emergencies? Like in emergency care, at times some invasive procedure might be required all of a sudden. Let's say we have only 2 hours and we have to perform some emergency procedure. Maybe in some procedures we can wait for, like, let's say 24 hours or so. So what is the PGI protocol for testing, COVID testing of such patients?
Well, PGI has gone through various testing wherever we can wait, say for example, for more than 8 hours or 10 hours or 24 hours. The routine COVID testing that is being practiced in PGI, and that is which takes the PCR RT is the method which is there. Of course, it is an antigen based this thing, but because the report comes in 8 to 10 hours period, so wherever any kind of emergency procedure where we can wait, for some time, supposing, say for example, it's a fracture case and we have to do, and before that testing has to be done, so 8 to 10. But wherever the procedure we cannot wait for long, say for example spreading Ludwig angina and we have to drain the abscess and all, so the other short procedure, that is gene expect system, that should be done, and where the report at best, of course Dr. Vidyarathan has said that in 45 minutes the report is ready, but by the time you get, it almost takes 1.5 to 2 hours. So wherever we can wait for that period, so we can go in for this test wherever it is. But I would again insist that any case which is coming for emergency and something may be immediately have to be done, or whether it is positive or negative, it is a suspected case and it should be taken as a positive case, and we should take wherever we are doing any invasive procedure, because care of the healthcare provider is very important. If the healthcare provider gets infected, he is likely to spread infection to so many other people. So we should be very, very particular to supervise and ensure, and because I have seen, some of the youngsters, they are very keen to continue to provide the, dental treatment to their patients, but we have to make them sure that they use the proper kits and are taking care of that. And even to such an extent that the person at the receptionist, that should be sitting, maintaining the distance, and should be wearing the mask, preferably if possible N95, otherwise 3-layered mask if the distance is good enough. So that's good enough.
So again, the take-home message says that PPE is important in terms of handling the dental emergencies as well. And in case of suspected patients, if it is an acute emergency, we can wait for like 2 to 3 hours. So gene expert is the test. And wherever we can wait for like 7 to 8 hours, we can go for an RT-PCR. Well, thank you, Professor Gaba, for this answer. Dr. Vidya, taking the talk ahead about infection control, pre-procedural mouth rinse is what is being suggested. But it has been seen that chlorhexidine is not very effective as a pre-procedural mouth rinse in COVID, as far as COVID is concerned. So what do you suggest? What is to be used for pre-procedural mouth rinse?
For pre-procedural rinse, it is recommended to use povidone iodine, which may be ranging from 1% to 5%. And then other recommended reagent is hydrogen peroxide, which is around 1.5%. You have to dilute it because hydrogen peroxide is quite astringent type. It can cause mouth ulcers, and we have been using povidone iodine, and I will recommend to use povidone iodine because it is easily available in dental clinic. And hydrogen peroxide 1.5% mouthwash may not be available, or when it is available in 5% or 20 volume, then you have to dilute it, and at the time of dilution there might be some error, and then it may cause burns inside the patient's mouth.
So povidone iodine is recommended over and above hydrogen peroxide,
Yes.
although H2O2 can also be used. Professor Gaba, there is a lot of talk going on about hydroxychloroquine. And as a prophylactic drug, especially among the healthcare workers, the ICMR has issued some guidelines. So, what is the PGI take on hydroxychloroquine?
Well, we have gone through the literature on this in detail and found that it, of course, anti-malaria drug. This has been, useful in some viral, but these are all, clinical observations or clinical cases which are there. But there is no trial, long-term trial, which has come up. But of course, ICMR recommends. Then see, we have to be very careful because it has got its own problems which cannot be overlooked, and at times people can be over enthusiastic to use this, and they'll end up into problem. And because over the counter sale has been, that is the reason it has been stopped. No doubt even India has been exporting it, but as such the PGI has not been recommending prophylactic use except in case of when there is a problem, some respiratory problems are there, and there it has been used and has been found to be effective, but not as a prophylactic because there is data lacks on this.
So, we have insufficient data on the efficacy of hydroxychloroquine as a prophylactic drug, but still on the proper consent of those healthcare workers who are working in COVID positive duty, the drug is being given in form of like a DOTS therapy. So that is a practice which is going on at PGI. Well, thank you, sir, for this answer. Dr. Vidya, taking the talk ahead, you had talked a lot about creating a negative pressure area or use of high volume suction devices. So can you explain it a bit more? What does this negative pressure means?
Negative pressure means that air which is inside the room is being thrown out and fresh air is coming inside. And when you have dedicated air handling units, then these are exchanging fresh air, throwing fresh air into your room at least 16 times per hour. So that maintains the cleanliness of the air in your room, and that prevents spread of infection.
Well, thank you, sir, for this answer again. Professor Gaba, one more question to pose here is about the use of face shields, which is being recommended. But there are many face shields which are available in the market, which has a layer of foam on the inside surface, which rests on the forehead, a layer of foam. So probably that is difficult to disinfect, and that foam, because of that foam, they cannot be used again. What is your take on that?
Well, face shields are otherwise, but there are certain face shields which are available which are without that foam layer also. That's just a plastic thing, and the disposable kind of face shield, they are quite good and have been found to be quite effective also, because it covers the complete face and nothing can, no splash can fall upon you. But otherwise, most of the PPE kits which have been, well, there is the eye wear which is there, that is being used, even if eye wear is covering nicely, so that is useful. But one Dr. Vidyarathan showed with positive pressure where the hood comes, and that face shield, which is again disposable, only thing is it's economically quite expensive, because that hood costs around 550 rupees, and it creates, of course, the complete equipment costs around a 1 lakh of rupees, which with positive pressure, and that means you have got everything fresh air inside for you. But that is very useful because it covers completely, and then there is no scope of this sponge or any kind of this thing that which can, and it's a disposable one also. So one has to look at these different aspects which are available, and one has to see which are more useful rather than going in for those with foam cover which used to be there. Even for PPE kits, apart from the material, apart from its certification, what is most important is easy to put it on and easy to remove it. Not that while removing it's difficult and then you contaminate yourself. So that is very, very important. That should be taken into account. And because like PGI has made a committee which any kind of donation or any kind of purchase which is made, that kits are really worn by the committee members, and they practically see the practical problems with that and then only approve it.
Well, thank you, Professor Gaba. So the take-home message is again quite clear that such face shields which are having a foam lining are difficult to disinfect, and the use of such face shields, reuse of such face shields should be avoided. Coming on to the next question, Professor Vidyaratan, it is about the mask hygiene. Wearing of mask is important, N95 is important. You have explained quite well the difference between FFP1, N95 and a normal 3-layer surgical mask. But mask hygiene is again quite important, where it has been observed that most of the healthcare workers, including the dentists, are at fault. So do you have some take-home message on mask hygiene?
Yes, mask hygiene is very important because external of the mask is considered to be as contaminated. If you are going to touch external of the mask which you are wearing, then your hands get contaminated, and then this can be transferred to surfaces and to the patient. So one is you should not touch the external surface of the mask with your hands, and if you touch it, then you have to antiseptic solution you have to use to clean your hands. Other is mask should not be hanging onto your neck because these are infected and this will be touching your scrub suit, and then that infection will get transferred to your scrub suits, and then it can be further spread. And then when masks become wet or visibly soiled, then you have to change them. And you should not try to reuse them, because there is human tendency that visibly it's looking clean to me, I will put it in my pocket, and tomorrow or maybe after 1 hour or after eating something I will reuse it. Then this should be avoided.
Thank you, Professor Vidya. So the effectiveness or efficacy of this mask is only up to a time period of maximum 8 hours. So it can be worn for up to 8 hours, but in a single
Yes.
use. And we should not rather preserve the mask and reuse it on other appointments. Well, thank you so much for this. Can you also throw some light on the steam sterilizer, which you had shown a beautiful video to the viewers? So can you throw some more light onto this?
So basically it takes tap water, there is a heater and there is a mechanism to superheat it, and it reaches the temperature of up to 140 to 180 degrees centigrade. And when it is coming from a nozzle, there is a recommended distance between the surface and the nozzle. Then you have to keep a specific distance, and then it can disinfect around up to 4 log, means 99% of the vegetative and viral particles onto the surfaces can be cleaned with this.
Well, thank you, sir. Professor Gaba, there is an interesting question from one of our viewers, and they just want to know if you have come across some autoclavable PPE kits.
Well, that means the one is planning to reuse.
Reuse, yeah.
So far, there is none available which is there, and I don't think at the moment there is no scope on this, because it's very contagious virus, and attempt has not been made on this. Maybe in due course of time, you never know. such things do come up. But again, there will be certain parts only which will be there. Now, as far as the gown is concerned, is soiled and then autoclaving and reusing. I do not, at the moment, doesn't appear to be feasible.
Well, thank you, sir, for answering this. Professor Vidyarathan, is there any use of a pulse oximeter in the patient screening area?
Patient screening area, when patient is asymptomatic, I do not think that his or her saturation level will fall so much when patient is coming to your clinic for dental treatment, for elective treatment. Then patient saturation level, if patient is having visibly fever, cough, and obstructive lung disease, only then saturation level fall. But for just screening purpose, I will not recommend pulse oximeter.
Well, thank you, sir. Again, taking one more question with you, Professor Vidyarathan. It is about the cost of the steam sterilizer which you had, a tentative cost for this
Cost of
sterilizer.
steam sterilizer is above, I think, 1 lakh rupees.
Okay, and how do you recommend the disinfection of impressions and casts?
Impression and cast, the standard precautions which you have been taking before. There are manufacturer recommendation, for example, alginates or rubber-based elastomeric materials. You can disinfect with the help of sodium hypochlorite sprays, but at this time sprays are being avoided. So you can pack them in a double layer after thoroughly washing and putting sodium hypochlorite according to manufacturer recommendation, and then you have to pack it in a well sealed in a container, and then you have to transport it to the lab.
And also you had talked in detail about N95 mask, where you had described about walled and non-walled masks. But still there is some kind of an ambiguity, and some of our viewers have posted a further clarification on this, whether both are equally effective or whether the non-walled is preferred, as you have said in
a clinical setup, I will prefer non-valved, because valved mask is opening to the environment. When you exhale, there is a just simple flap, it will open up and air will go out, and that unfiltered air from the healthcare worker is being transferred onto the patient face, which I will not recommend.
Thank you, sir. And this is the last question for the day, and I would like Professor Gaba to take this question, and it is about the spread of COVID infection through surfaces and articles. So patients do visit dental clinics, and at times in dental clinics we have various articles kept, like magazines and other things, which are coming in frequent contact with the patients, with attendants and the staff. So what is your say on that?
See, magazines or newspapers or such like things should not be kept in the waiting area. It should be completely stopped, and there should be as minimum things available in the waiting area as possible, so that patient, while waiting, they do not have attempt to touch those things, because certainly if it gets touched by, it will be very difficult to know even that such thing has been touched, and then touched by others, so infection can spread. So I would rather suggest that there should be as minimum people in the waiting area as possible. So the appointment should be given in such way, staggered and very timed, that when the patient comes, you are able to directly take him to the clinic and do the work and send back, and so that there is no waiting there.
And how about the air conditioners? Because the temperature is rising now.
The fresh air, as much as we can say, again with the positive air pressure, fans and opening the doors, that is better than going in for, especially centralized air conditioners, that should be avoided, because any patient, suspected patient or infected patient, comes over there, it goes into the air, and then many will get infected, so that should be avoided.
So the take-home message is that fresh air should be promoted, and because in air-conditioned rooms, the same air is being circulated maybe for the last 1 day or 2 day, almost a similar kind of an air is being circulated. So that is a bit, that is a probable health hazard. And at the very same time, there is a strict no to centralized air conditioners. Well, with this, we have come to an end of today's webinar, and we had an overwhelming session, a lot of questions. We really apologize for not taking a few of the questions because of time constraint, and this is your chance to send us your questions through the PGI COVID-19 helpline. You can very well connect with this helpline number on 2755 and also there is a teleconsultation and or PGI dental teleconsultation number which was flashed on your screen. You can very well write to us on ohscteleconsult@gmail.com, and also you can try contacting these helpline numbers. With this, I want to thank the esteemed panel of experts for the day, Professor Gaba and Professor Vidyarathan, and also many thanks to all our viewers who had joined us. Also, I wish to welcome you for the next webinar, which will be webinar 10, and it will be on mental health issues for the nursing staff. And this webinar is scheduled on coming Friday at 12 noon. Until then, I am signing off. Goodbye.